My name is Ashley Romina Murillo, and I'm going to talk about segmental neurofibromatosis. As a definition, we can say that the neurofibromatosis is a group of neurocutaneous disease, autosomal dominant inheritance showing extreme clinical heterogeneity and are characterized by abnormal growth of tissue derived from the neural crest, embryonic derived affecting skin, soft tissues, bones, and nervous system.
In NF1 patients, we frequently see a lot of cutaneous tumors. These are neurofibromas. Depending on the location, they can be either more superficial or more deeply seated, which can be very disabling for the patients. And these tumors have the propensity to frequently become malignant. There are also other tumor types affecting central nervous system. In neurofibromatosis type 2, we typically see different kinds of tumors. The most commonly seen tumor is an acoustic schwannoma.
My name is Dr. Radhika Damija. I, along with Dr. Mrugala, co-direct the Neurofibromatosis Clinic at Mayo Clinic in Arizona. We've put together a multidisciplinary effort to take care of patients with both neurofibromatosis type 1 and neurofibromatosis type 2. Both these conditions are genetically and phenotypically very distinct. These patients often have complex needs and need a multidisciplinary care.
At Mayo Clinic, what we're really best at is complex care. And this is a great example of our ability to truly translate idealism into action. When you come to Mayo Clinic as a neurofibroma patient, you're going to get to meet all of your specialists, and where plastic surgery comes in is helping to plan the incisions, helping to execute the operations, and helping to ensure that that patient gets the most aesthetically pleasing outcome at the end of that operation.
Our goal as neuro-oncologists when we work alongside of the neurosurgeon is to make sure that we're able to maximize the amount of treatment the patient is able to receive, specifically surgery in many cases, while preserving their neurologic function. We're so fortunate here at Mayo to have a proton beam facility, and there are certain instances where proton therapy is even far superior to typical photons. Having the ability to collaborate with a different specialist really helps us make sure that we're able to take the best care of the patients, and also to make sure that from a neurologic standpoint we don't lose sight of who they are as a person and what's important.
For more information on this condition or to refer a patient to us, please call us or visit us at mayoclinic.org.
The cause is a somatic mutation gene, polyzygotal neurofibromatosis type 1, in the early stage of embryonic development of neural crest with somatic mosaicisms and at times gonad, which explains hereditary cases.
In this health sketch, we want to talk to you about neurofibromatosis. It's a bit hard to say, but the name makes sense. Neuro means the nerves in the body, while fibromas are the lumps that occur with the condition. There are different types of neurofibromatosis, and in this video, we'll be talking about the most common type, NF1, which approximately 1 in every 2,700 people are born with. It is caused by a change in your genes, which is either inherited from a parent or a new random change in the cells that create a baby. This genetic change causes lumps to grow on the nerves. A number of different criteria are used to help diagnose NF1, and genetic testing may also be used. The most noticeable signs appear on the skin, which might be present at birth or may develop in early childhood. Flat, light brown patches on the skin, called café au lait spots, or cals because they are a similar color to milky coffee. They're often dismissed as just birthmarks. Freckles in unusual places, such as the armpits or groins. Lumps or bumps, either on or under the skin, which vary in size and number. Small lumps called cutaneous neurofibromas are generally harmless, and there may be few or many. Large lumps called plexiform neurofibromas tend to be few in number and are more likely to cause problems. Doctors can advise if removal or medication is possible. It's important to know that NF1 affects everyone differently. While some will have only mild symptoms, NF1 varies so much that others may have serious complications and additional related conditions. These might include learning difficulties, autism or ADHD, which will probably require more support in school. Problems with the joints and the bones, such as hypermobility, fractures, curving of the legs or spine, and changes to the shape of the chest wall. Problems with eyesight, if the nerve to the eye is affected. High blood pressure, which can be a sign of other complications. Epilepsy and other symptoms that relate to the nervous system. Disfigurement, which may or may not cause anxiety and impact on quality of life. In some cases, tumors such as brain and breast cancer. Because of this risk of complications, and because NF1 can change over time, it is important to report new or changing symptoms to your doctor so that problems can be picked up early. You should also have a routine checkup at least every year with someone who knows about the condition. Further tests may be required, such as an imaging test, and there may be treatments for specific problems, such as surgery. Depending on the symptoms experienced, a team of professionals might be involved in care, such as a pediatrician, geneticist, neurologist, dermatologist, eye specialist, bone specialist, oncologist, psychologist, and others. It is common to sometimes feel worried or upset about having NF1 or having a child with NF1, and you should discuss these
things and symptoms. It is characterized by neurofibromas, coffee, colored spot, unilateral and dermatomal distribution without visceral involvement, and epilates and arenes are groins, leash nodules, and bone defects.
Neurofibromatosis is a genetic neurological disorder that can affect the brain, spinal cord, nerves and skin. Tumors, or neurofibromas, grow along the body's nerves or on or underneath the skin. These are classified with two distinct types: neurofibromatosis type 1, NF1, and NF2. NF1, formerly known as von Recklinghausen's NF, is the more common of the types. NF is defined by tumors, called neurofibromas, that grow along nerves in the body or on or under the skin. As the tumors increase in size, they compress on vital areas of the body, causing problems in the way the body functions. The tumors arise from changes in the nerve cells and skin cells. Tumors also may press on the body's vital areas as their size increases. NF may lead to developmental abnormalities and or increased chances of having learning disabilities. Neurofibromatosis symptoms. Neurofibromatosis can be affected in many different ways. Morbidity is often a result of plexiform neuromas, optic gliomas, or acoustic neuromas, but mortality can also be associated with malignant transformation of the neuromas, such as neurofibrosarcomas. There is a high incidence of learning disabilities or cognitive deficit. However, severe retardation is not part of the syndrome. Because of the tumor-generating nature of the disorder and its involvement of the nervous system, and also because of early onset microcephaly in the pediatric population, there is often an increased chance of development of epilepsy in those affected.
Pros and cons. It is described that segmental neurofibromatosis from predominant affects women in a ratio of 2 to men with men. Age of onset is typical bimodal, with peaks between 10 to 13 years and 15 years. No cases have been reported at birth. Neurofibromas most commonly occur cervical dermatomas or chest level and are unilateral, occurring more frequently on the right than on the left. Issues apply in Ecuador. In Ecuador, there are no precise data on the incidence of neurofibromatosis.
My name is Dr. Rajesh Shah. I am a director of Life Force, where we treat patients using homeopathy from all parts of the world. Today I am going to tell you about the role of homeopathy for the treatment of benign tumors such as 1. Neurofibromatosis, 2. lipomas, and 3 skin tags. Neurofibromatosis is a tumor, a benign tumor affecting the nose, which can be either 1 or 2 cherry-like growth in any part of the body, especially on the face or neck or back or limbs or hands and legs. Neurofibromatosis can be multiple. It can have multiple cherry-like growth, or it can have a huge growth as big as an apple or even larger than that with some patients. This is a genetically determined disorder where the children of the patients affected with neurofibromatosis can have around 50% chances of getting this disease. Homeopathy has no cure whatsoever to reduce the size or to regress neurofibromatosis at all. In some cases, around 6 to 8 cases, we have observed some slowing down of the process of neurofibromatosis growth, but I cannot say for sure because we do not have significant study as yet. In case of lipomas, which are the benign tumors of the fatty tissues, homeopathy has no cure to offer, and such cases are better left untreated without giving any kind of homeopathy. Third, the skin tumors, the skin tags, which are often found on the neck or in the armpits or axilla. These tumors resemble warts, but they are actually not warts. And these skin tumors or skin tags cannot be treated using homeopathy. So I believe this information about the soft tumors and homeopathy treatment will prove useful to the readers. Thank you very much.
As a conclusion, we can say that the segmental neurofibromatosis is a rare and difficult to manage because of the high rate of recurrence of the disease neurofibromas. Each patient presents gonadal mosaicisms, may have offspring with one classical neurofibromatosis, and although patients with this type of neurofibromatosis have a lower risk of developing malignant tumors and the peripheral shift, still monitoring is recommended.
Here is a mnemonic for neurofibromatosis type 1. The first thing that always comes to mind when thinking about neurofibromatosis is always cafe au lait spots. That's useful, as the mnemonic itself is cafe spot. C, the first letter of the word cafe, reminds us of cafe au lait spots. A stands for axillary inguinal freckling. F4, fibroma. E stands for eye, that is, Lisch nodules. S4, skeletal, as patients have bowing leg, other bone defects. P reminds us that this disorder is linked to genetics. P stands for pedigree, positive family history. Lastly, O, N, T of the word spot stands for optic tumor, that is, glioma. Hope this mnemonic.
Thank you.